Because of the stability of the joint and the need for proper function of all these muscles, there's a number of symptoms that can happen over time without an acute injury. Probably the most common one that I see is called impingement or rotator cuff tendonitis. And that's an inflammation of the rotator cuff right in this area, especially as the arm is lifted up and these muscles pass underneath the point of the shoulder called the acromion. That can cause what we commonly know as impingement, rotator cuff tendonitis, or bursitis. Those are really three words for the same condition. And once these tendons get inflamed, the muscles don't function as efficiently, and most of us feel pain right over the deltoid, or this part of our shoulder right here. This is one common cause of what we call referred pain, so that even though the problem is in the shoulder joint up here, people feel the pain down here. Another commonly injured part of the shoulder is the biceps tendon. That's a part of the rotator cuff and functions integrally in the shoulder. And with some overuse injuries, whether it be at work or in the gym, you can get biceps tendonitis, and that causes a sharp pain right in the front of the shoulder here that often radiates into the biceps muscle or even down towards the elbow. A more acute injury of the rotator cuff is called a tear. That can happen from an accident while skiing, with a fall, with a car accident, or any other acute injury that torques the shoulder in such a way that the rotator cuff tendon actually rips away from the bone. That's a more acute injury that often requires surgical repair, depending upon your age and activity level. There's injuries of the rotator cuff that fall in between just tendonitis and a tear, and those are what are called partial tears. So at times when someone uses the shoulder, especially with overhead lifting at sports, in laboring type occupations, the rotator cuff can wear away over time and thin out, and that can cause pain as well. Some of those injuries need surgery, some can be treated just like tendonitis with anti-inflammatory medication and physical therapy, as well as rest from any activities that are causing the pain. Another common group of injuries in the shoulder is instability. So that's true of any joint in the body. Instability is when the bones aren't in their normal position relative to one another, either at rest or when you start to use them. So in the shoulder, instability is often called dislocation, and that often happens from a traumatic injury such as a fall while trying to tackle an opponent in football or any other forced overhand type injury. As the arm comes up, the ball can actually pop out of the socket, causing what's called a dislocation, injuring the ligaments in the shoulder.